Good morning, everyone. I'm excited to welcome you all today as we dive into the important topic of pediatric anesthesia with HASMAT. Today's presentation will cover key aspects of pediatric anesthesia, including safety considerations, techniques, and best practices. We'll also look at some recent updates and practical tips to enhance patient care. Let's get started. Children are not little adults, and that's a crucial point to remember when we're considering pediatric care. The different age classifications in pediatrics help us understand the unique needs of each group. For example, neonates are babies from birth up to 30 days old. Then we have old infants, which are children from 1 month to 1 year. Small children, or toddlers, are typically between 1 and 4 years old, and older children are from 4 to 12 years. Recognizing these distinctions is essential because each group has different physiological and developmental characteristics. When we look at neonatal classifications, we see that full-term neonates are born between 37 and 40 weeks of gestation. Premature neonates, on the other hand, are born before 37 weeks, which often presents additional challenges due to their underdeveloped organs and systems. Now, an important consideration is the anatomical and physiological differences within these groups. Interestingly, a child aged 10 to 12 years is often considered an anatomically and physiologically small adult. This means that, by this age, their body and organ systems are quite similar to adults, which impacts how we approach their medical treatment and care. Overall, understanding these classifications and distinctions helps us tailor our approach, ensuring that children receive the appropriate and effective medical attention they need at each stage of their development. Let's take a closer look at how different anatomy, physiology, and pharmacology all play a role in understanding how various drugs work across different populations or even different species. When I say different anatomy, I mean that the structure of tissues and organs can vary quite a bit, which influences how a drug is absorbed, distributed, or eliminated. Then, with different physiology, we're talking about how the functions of those organs and systems can differ, like how blood flow or enzyme activity might change from one individual to another. And finally, different pharmacology refers to how drugs interact with these unique biological features, meaning their effects, side effects, and metabolism can all differ based on these anatomical and physiological differences. Recognizing these distinctions is key because it helps us tailor treatments more effectively and safely. It's a reminder that one size doesn't fit all in medicine, and understanding these variations allows us to optimize patient care, especially in diverse populations. This concept ties back to the overall theme of personalized medicine and the importance of considering individual differences in pharmacotherapy. Let's take a closer look at the anatomical changes in the respiratory system during infancy. First, you'll notice that the head is quite large in infants, approximately 1/3 the size of the adult head. This gives the baby a proportionally bigger head compared to the rest of the body. The head is also short with a prominent occiput, which is the back part of the skull. Moving on, the tongue in infants is large relative to the mouth, which can sometimes contribute to airway obstruction. The nasal passages are narrower in infants, making nasal breathing very important until about 5 months of age, as they are obligate nose breathers during this period. The epiglottis is also different. It's narrower and U-shaped, and it tends to flop posteriorly, which can influence airway patency. The larynx, or voice box, is positioned higher and more anterior than in adults, roughly at the level of C3-C4 vertebrae, whereas in adults, it's around C5-C6. This higher position is significant because it affects both airway protection and phonation. The cricoid cartilage, which is part of the larynx, is more conical in infants and is narrowest at the cricoid ring. In adults, the narrowest part of the airway is at the level of the vocal cords. The trachea in infants tends to deviate posteriorly and downward. It gradually becomes more similar to the adult anatomy, typically between 8 to 10 years of age. Understanding these differences is key because they influence how we manage airway patency and ventilation in infants, especially in clinical settings. Let's take a closer look at airway anatomy differences. Understanding these variations is crucial because they can significantly impact how we manage airways in different patients. For example, some individuals have a naturally narrower or more angulated airway, which can make intubation more challenging. Others might have anatomical variations like a larger tongue or a differently shaped larynx. Recognizing these differences helps us anticipate potential difficulties and tailor our approach accordingly. This knowledge is a key part of the overall theme of safe and effective airway management, ensuring we provide the best care possible by being prepared for the unique anatomy each patient presents. This slide doesn't contain enough information. That's why we're moving to the next slide. The narrowest part of the airway is actually at the cricoid cartilage rather than the vocal cords. This means that even if a tube is small enough to pass through the vocal cords, it might still get stuck at the cricoid level. It's a crucial point to remember when selecting airway equipment. Since the larynx is funnel-shaped, secretions tend to accumulate in the retropharyngeal space, which can complicate airway management. Understanding this anatomy helps us anticipate potential issues, especially in emergency situations or when performing procedures like intubation. Connecting these points to the overall theme, knowing where the narrowest point is and how secretions can gather helps us improve both our planning and our response to airway obstructions. It emphasizes the importance of detailed anatomical knowledge in ensuring safe and effective airway management. Let's take a closer look at the differences between infant and adult airways. Starting with the head, infants have a large, prominent occiput, which often means we need to position their head to achieve a sniffing position for easier airway access. In contrast, adults typically have a flatter occiput. Moving on to the tongue, the infant's tongue is relatively larger compared to the oral cavity, which can potentially obstruct the airway more easily. Adults, on the other hand, have a proportionally smaller tongue. Now, regarding the larynx, in infants it is positioned more cephalad, meaning higher up, roughly opposite the C2 and C3 vertebrae. In adults, it is situated lower, opposite the C4 to C6 vertebrae. This higher placement in infants impacts airway management strategies. The epiglottis also differs. Infants have an omega-shaped, soft epiglottis, which is more flexible and can sometimes make visualization a bit more challenging during intubation. In adults, the epiglottis is flatter and more rigid. When it comes to the vocal cords, infants have shorter, concave cords, whereas adult vocal cords are longer and more horizontal. The narrowest part of the airway also varies. In infants, it is at the cricoid ring, located below the vocal cords, while in adults, the narrowest point is at the level of the vocal cords themselves. In terms of cartilage, infant laryngeal structures are softer and less calcified, making them more flexible but also more fragile. Adult cartilage is firmer and more calcified, providing greater structural support. Finally, the lower airway in infants is smaller and less developed, with less cartilage support compared to adults. These differences are crucial because they influence how we approach airway management in infants versus adults, ensuring we adapt our techniques to their anatomical distinctions for safe and effective care. Let's talk about some important clinical implications. First, the sniffing position, which many think helps with bag mask ventilation or visualizing the glottis, actually doesn't make much difference in these cases. Instead, the head should be kept in a neutral position to optimize airway management. When it comes to laryngoscopy, using a straight blade often provides better visualization of the vocal cords, making intubation easier and safer. Another key point is about endotracheal tubes, or ETTs. If the tube fits too tightly, it can cause local swelling or edema. Just a tiny one swelling can actually narrow the airway by up to 60%, which is significant. So ensuring the right fit is crucial. For younger children, especially those under 8 years old, an uncuffed ETT is generally preferred. This is because their cricoid cartilage, which forms a natural seal, is not fully developed until about 10 to 12 years of age. Once fully developed, cuffed tubes can be used more safely. All of these points highlight how anatomical differences and proper technique are vital in airway management, tying back to our overall theme of ensuring safe and effective airway control in various patient populations. This slide doesn't contain enough information. That's why we're moving to the next slide. Now, let's take a closer look at the physiological changes in the respiratory system. As we age, several key adaptations occur that impact how our lungs and airways function. For instance, the elastic recoil of the lungs decreases, which means the lungs aren't as stretchy as they used to be. This can make it a bit harder to breathe out completely. Additionally, the chest wall becomes stiffer, reducing overall lung capacity. Another important change is that the strength of the respiratory muscles, like the diaphragm, tends to decline. This can lead to decreased ventilation efficiency and less effective clearing of mucus from the airways. Also, the cilia, or tiny hair-like structures that help trap and remove particles, become less effective, which can increase susceptibility to respiratory infections. All these changes are connected to the overall theme of how aging affects bodily systems. They highlight the importance of understanding these physiological shifts so we can better manage respiratory health as we get older. Recognizing these changes allows us to take proactive steps to maintain respiratory function and improve quality of life. This slide doesn't contain enough information. That's why we're moving to the next slide. This slide doesn't contain enough information. That's why we're moving to the next slide. Let's take a closer look at the cardiovascular system. This system is essentially the body's transportation network, responsible for moving blood, nutrients, oxygen, and hormones to cells throughout the body. It's made up of the heart, which acts as the pump, and the blood vessels, which serve as the pathways. The heart is a muscular organ that beats continuously, ensuring blood circulates effectively. The blood vessels are categorized into arteries, veins, and capillaries, each with a specific role in transporting blood. Arteries carry oxygen-rich blood away from the heart, while veins return deoxygenated blood back to the heart. Capillaries are tiny vessels where the exchange of oxygen, nutrients, and waste products occurs at the cellular level. Understanding how this system works is fundamental because it directly impacts overall health, influencing everything from energy levels to the function of vital organs. When the cardiovascular system functions properly, it supports our body's ability to perform daily activities and maintain homeostasis. Now, let's take a closer look at sinus arrhythmia and what's considered normal. Sinus arrhythmia is a variation in the heart rate that originates from the sinus node, which is the natural pacemaker of the heart. What makes it interesting is that it's actually a normal phenomenon, especially in young and healthy individuals. It often occurs with breathing speeding up slightly during inhalation and slowing down during exhalation. This variation is a sign of a healthy, responsive heart. So, when we see sinus arrhythmia on an ECG and it's within normal limits, it indicates that the heart's natural rhythm is functioning properly and responding well to the body's needs. Recognizing this as a normal variant helps us avoid unnecessary concerns or interventions. It's a good reminder that not all irregularities are signs of pathology. Some are just part of the body's normal rhythm. This slide doesn't contain enough information. That's why we're moving to the next slide. This slide doesn't contain enough information. That's why we're moving to the next slide. Let's talk about age-related changes in vital signs. As people get older, it's common to see certain shifts in their vital signs that we should be aware of. For example, blood pressure tends to increase, partly because of stiffening arteries and other cardiovascular changes. Heart rate may also change slightly, often decreasing at rest, but the overall rhythm remains important to monitor. Respiratory rates might stay relatively stable, but lung capacity can decrease, making breathing a bit more labored during exertion. Body temperature regulation also becomes less efficient with age, so older adults might not mount as high a fever or may feel cooler than expected. Recognizing these normal age-related changes helps us differentiate between typical aging processes and signs of potential health issues. It's essential to keep these variations in mind when assessing older patients, ensuring we provide appropriate care and interventions. Let's take a closer look at the renal system. The kidneys, which are the primary organs here, play a vital role in filtering blood. They remove waste products and excess substances, helping to maintain a healthy balance of fluids and electrolytes in the body. This process is essential for overall homeostasis. The renal system also controls blood pressure through the regulation of fluid volume and the release of hormones like renin. Additionally, the kidneys are responsible for producing erythropoietin, which stimulates red blood cell production. Understanding how this system functions is key because it connects directly to many other bodily systems and overall health. Maintaining kidney health is critical for the body's ability to detoxify and regulate vital functions effectively. This slide doesn't contain enough information. That's why we're moving to the next slide. Let's take a closer look at the hepatic system. The liver, which is at the core of this system, plays a crucial role in maintaining our overall health. It's responsible for processing nutrients absorbed from the digestive tract, detoxifying harmful substances, and producing vital proteins. The hepatic system is interconnected with other bodily systems, highlighting its importance in metabolic regulation. Understanding how this system functions helps us appreciate how our body manages energy, detoxification, and overall homeostasis. So, as we continue, keep in mind how central the liver truly is to our well-being and how it supports many processes essential for survival. Now, let's turn our attention to glucose metabolism, which is a fundamental process in how our bodies generate energy. Glucose, as many of you know, is a primary source of fuel for our cells. It's essential for maintaining our overall energy balance and supporting various cellular functions. When we talk about glucose metabolism, we're referring to the series of biochemical reactions that convert glucose into usable energy, primarily in the form of ATP. This process involves several key steps, starting with glycolysis, which occurs in the cytoplasm and breaks down glucose into pyruvate, generating some ATP and NADH in the process. From there, if oxygen is available, pyruvate enters the mitochondria and proceeds through the Krebs cycle, or citric acid cycle, which produces more high-energy molecules. These molecules then feed into the electron transport chain, where most of the ATP is generated. Understanding this pathway is crucial because disruptions in glucose metabolism are linked to various conditions, including diabetes and metabolic syndrome. It's also a prime example of how our bodies efficiently extract energy from the foods we eat, connecting back to the overall theme of metabolic health and homeostasis. So, in this section, we're emphasizing the importance of glucose as a central energy substrate and exploring how its metabolism supports not just individual cell functions, but overall health. Let's talk about thermoregulation, which is a crucial aspect of how our bodies maintain internal stability. Essentially, it's the process that keeps our core temperature within a healthy range, despite changing environmental conditions. Our bodies have several mechanisms to achieve this balance. For example, when we're too hot, we sweat to cool down through evaporation. Conversely, when we're cold, we might shiver to generate heat or constrict blood vessels to conserve warmth. These responses are part of a complex system that involves the brain, particularly the hypothalamus, acting as the body's thermostat. Understanding thermoregulation is important because it directly impacts our overall health and performance, especially in extreme environments or during physical activity. It highlights the body's incredible ability to adapt and stay balanced despite external challenges. This slide doesn't contain enough information. That's why we're moving to the next slide. Let's take a closer look at the effects of hypothermia. When the body temperature drops below normal, it can have serious impacts on various bodily functions. For starters, hypothermia significantly slows down the metabolic processes, which affects the heart and brain. This can lead to confusion, drowsiness, and even loss of consciousness in severe cases. It also causes blood vessels to constrict, which can reduce blood flow to vital organs, increasing the risk of organ failure. Additionally, as the body struggles to generate heat, shivering occurs initially, but if hypothermia worsens, shivering stops, a sign that the body's thermoregulatory system is failing. Understanding these effects underscores the importance of early recognition and treatment. It highlights how hypothermia isn't just about feeling cold. It can impair critical functions and pose life-threatening risks. This knowledge ties into our overall goal of effective prevention and intervention strategies. All right, let's talk about the central nervous system. This is essentially the control center of our body. It includes the brain and the spinal cord, and it's responsible for processing all the information we receive from our environment and inside our bodies. Think of it as the command hub that coordinates our thoughts, movements, and even our basic bodily functions. The brain, as the most complex organ, handles things like thinking, memory, emotions, and decision-making. The spinal cord acts like a highway, transmitting signals between the brain and the rest of the body. Understanding the central nervous system is crucial because it forms the foundation for how our entire nervous system operates and how we respond to the world around us. It really highlights the importance of maintaining neurological health for overall well-being. This slide doesn't contain enough information. That's why we're moving to the next slide. Let's now turn our attention to hematology, which is a crucial part of understanding the overall health and function of the blood. Hematology covers a wide range of topics, but at its core, it involves studying blood components such as red blood cells, white blood cells, platelets, and plasma. These components are vital for oxygen transport, immune response, and clotting. One of the key points to remember is how abnormalities in any of these components can lead to various disorders, from anemia to leukemia. For example, a low red blood cell count might cause fatigue and weakness, while an abnormal white blood cell count could indicate infection or blood cancers. Understanding these processes helps us connect the dots between blood health and the broader theme of systemic health and disease prevention. It emphasizes how essential proper blood function is to overall well-being. By grasping the principles of hematology, we gain insights into diagnosis, treatment, and management of many conditions that impact patients' lives every day. Let's take a moment to explore the role of psychology in our overall understanding. Psychology, at its core, is about studying how people think, feel, and behave. It helps us understand why individuals respond the way they do in different situations. This understanding is crucial because it allows us to tailor our approaches, whether we're designing products, services, or even communication strategies. Throughout this presentation, we've seen how insights into human behavior can influence every aspect of our work. Recognizing psychological principles helps us create more effective and empathetic solutions. It reminds us that behind every decision or action, there's a complex web of motivations and emotions. So, when we consider the bigger picture, psychology isn't just an academic subject. It's a practical tool that enhances our ability to connect with people and meet their needs more effectively. This understanding is key to driving meaningful engagement and positive outcomes in everything we do. Let's now turn our attention to pharmacological changes. As we age, our bodies experience a variety of shifts in how they handle medications. These changes can significantly impact drug absorption, distribution, metabolism, and excretion. For example, gastric pH tends to increase, which can affect the solubility of certain drugs. Additionally, there is often a decrease in gastrointestinal motility, potentially delaying drug absorption. When it comes to distribution, the reduction in total body water and lean body mass can alter drug volumes of distribution, especially for water-soluble drugs. On the other hand, an increase in body fat can prolong the half-life of lipophilic drugs, making them stay in the system longer. Metabolism, primarily occurring in the liver, also tends to slow down with age due to decreased hepatic blood flow and enzyme activity. This can lead to higher plasma concentrations of some medications. Finally, renal function declines gradually over time, reducing the clearance of drugs excreted by the kidneys. Recognizing these pharmacological changes is crucial for adjusting medication dosages and avoiding adverse effects, ultimately helping us provide safer, more effective care for our aging patients. Now, let's turn our attention to volatile anesthetics. These are a key component in general anesthesia, and they are characterized by their ability to vaporize easily at room temperature. When we talk about volatile anesthetics, we're referring to substances like sevoflurane, isoflurane, and dysflurane, which are commonly used during surgeries. The most important thing to remember is that these agents are inhaled and work rapidly because they are highly volatile, allowing for quick adjustments in anesthesia depth. This is crucial for maintaining patient stability throughout the procedure. Additionally, volatile anesthetics have specific properties like low blood solubility, which means they can produce rapid changes in anesthesia levels, making them very controllable. They also have effects on various body systems, including the cardiovascular and respiratory systems, so understanding their pharmacokinetics and pharmacodynamics is essential for safe administration. Connecting this to the overall theme, mastering the use of volatile anesthetics is vital for providing effective anesthesia care, ensuring patient safety, and achieving optimal surgical conditions. This slide doesn't contain enough information. That's why we're moving to the next slide. Let's now focus on perioperative anesthetic management, starting with the preoperative phase. This is a crucial step because it sets the foundation for a smooth surgical experience. During this stage, we thoroughly evaluate the patient's overall health, including their medical history, current medications, allergies, and any previous anesthetic experiences. It's important to optimize their condition as much as possible, controlling comorbidities like hypertension or diabetes, and addressing any issues that might increase surgical risk. We also plan the anesthesia approach tailored to the patient's specific needs, considering factors like age, weight, and the type of surgery. Preoperative communication is key. We explain what to expect, answer questions, and ensure the patient is as comfortable and informed as possible. This helps reduce anxiety and builds trust. Ultimately, this stage is about preparing both the patient and the anesthetic team to ensure safety, minimize complications, and promote a positive surgical outcome. Connecting this to the overall management, thoughtful preoperative planning is essential for the success of the entire perioperative process. Let's go through the different grades of surgical procedures and their associated requirements. Starting with grade 1, which we call minor surgery. These are typically simple procedures like circumcision or MRI investigations. They usually require minimal preparation and are less invasive. Moving on to grade 2, the intermediate level. These procedures are a bit more involved. For example, herniotomy or tonsillectomy. For these, we need to check blood parameters such as hemoglobin and platelets, as well as bleeding times and clotting tests like prothrombin time and activated partial thromboplastin time. These tests help us assess the patient's ability to clot properly. Next is grade 3 major surgery. An example would be augmentation cystoplasty. For these, we need a comprehensive preoperative workup including platelet counts, cross-matching blood for transfusions, kidney function tests like creatinine, urinalysis, and blood urea. We also check blood glucose, hemostasis parameters such as bleeding time and prothrombin time, and liver function tests if needed. Finally, grade 4, which involves major plus surgery, such as thoracotomy, neurosurgery, or cardiac surgery. These procedures require extensive preoperative assessments. This includes hemoglobin, cross-matching, chest X-ray, kidney function tests, blood tests, hemostasis assessments, lung function tests in older children, and arterial blood gases. Additionally, pulse oximetry is vital to monitor oxygenation during these complex surgeries. The key takeaway here is that, as the surgical grade increases, so does the complexity and the extent of preoperative investigations needed to ensure patient safety. This systematic approach helps us tailor our preparations according to the procedure's risk level. Let's go through the key recommendations for preoperative lab testing based on timing and patient age. First, regarding investigations like chest X-ray and ECG, you'll notice that these are generally not required for patients under 6 months and up to 1 year, regardless of the procedure. However, they may be considered in older children, but in this table, they are marked as not routinely necessary across all age groups. Moving on to investigations like FBC, hemostasis, RFT, RBS, and UA, You'll see these are recommended at various time points. For example, a full blood count, or FBC, is advised for all age groups, from less than 6 months to 16 years, indicating its importance in assessing overall health status before surgery. Hemostasis testing, which evaluates blood clotting, is also recommended for children under 6 months and from 6 months to 1 year, and again in older age groups. This underscores the importance of checking coagulation, especially in younger children, to prevent bleeding complications. Renal function tests, or RFTs, are advised across all age groups, which makes sense because kidney function can impact anesthesia and medication management. RBS, or blood sugar levels, are important especially in infants and young children, with testing recommended up to 1 year and again in the older age groups, highlighting the need to assess metabolic status preoperatively. Finally, urinalysis, or UA, is also recommended across all age groups, emphasizing the importance of screening for urinary tract infections or other abnormalities that could complicate surgery. Overall, the key takeaway is that preoperative lab testing should be tailored to the child's age and health status, with certain tests like FBC, RFT, RBS, and UA being consistently important across all age groups. This approach helps us ensure safety and optimize outcomes for our pediatric patients. Let's take a look at the pre-op fasting guidelines. As you can see, different types of intake require different fasting times before surgery. For clear liquids, the recommended fasting period is about 2 hours. This includes water, tea, or coffee without milk. Moving on to breast milk, which is more complex, the fasting time extends to about 4 hours. Infant formula requires around 6 hours. And for solid foods, especially those that are fatty or fried, it's safest to wait up to 8 hours before surgery. These guidelines are crucial because they help reduce the risk of aspiration during anesthesia. The goal is to ensure the stomach is as empty as possible at the time of surgery. Remember, the key is to balance safety with patient comfort, so following these timings is essential for optimal outcomes. This slide underscores the importance of tailored fasting times based on what the patient has consumed. This slide doesn't contain enough information. That's why we're moving to the next slide. Let's talk about premedication, which is a crucial step in preparing a patient for a procedure. It involves administering specific medications before the intervention to optimize conditions. The key goals are to reduce anxiety, provide sedation, and prevent any adverse reactions or complications. By doing this, we help ensure the procedure goes smoothly and the patient remains comfortable. Premedication can include medications like sedatives, analgesics, or antiemetics, depending on the patient's needs and the nature of the procedure. It's important to tailor this to each individual, considering their medical history and potential allergies. Overall, premedication is about setting the stage for success, reducing stress for the patient, minimizing risks, and improving the overall experience. It connects to our broader theme of patient-centered care and meticulous preparation to achieve the best outcomes. This slide doesn't contain enough information. That's why we're moving to the next slide. This slide doesn't contain enough information. That's why we're moving to the next slide. Let's talk about monitoring. Monitoring is a crucial aspect of any project or process because it allows us to keep an eye on progress and identify issues early on. When we monitor effectively, we can ensure that everything stays aligned with our goals and standards. It's about gathering data, observing outcomes, and making informed decisions. This helps us catch any deviations from our plan before they become bigger problems. Remember, good monitoring also provides us with valuable insights that can improve future projects. Ultimately, it ties into the overall theme of maintaining control and ensuring success through continuous oversight. Let's now turn our attention to induction. Induction is a fundamental concept because it helps us understand how to build general rules or principles from specific examples or observations. Essentially, it's about moving from particular instances to broader conclusions. This process is central to scientific reasoning, where we observe specific data points and then formulate theories or laws. One key point to remember is that induction always involves some degree of probability, not certainty. Just because something has happened repeatedly doesn't guarantee it will always happen the same way. That's why understanding the limits and strengths of inductive reasoning is so important in our overall discussion of logical processes. By grasping induction, we're better equipped to analyze how we develop knowledge and make decisions based on evidence. This ties back to our theme of critical thinking and the importance of sound reasoning in all areas of study and everyday life. So, in summary, induction is a powerful tool, but it requires careful application and awareness of its probabilistic nature. This slide doesn't contain enough information. That's why we're moving to the next slide. Now, let's take a closer look at the 5 components that form the foundation of this framework. First, we have the core idea, which is essentially the main message or the central concept you want your audience to understand. It's important because it guides everything else. Next, we have the supporting evidence, which includes data, examples, or stories that back up your core idea and make it more convincing. Then there's the structure, the way you organize your content to ensure clarity and flow, helping your audience follow along easily. Fourth, we need to consider delivery, which involves your tone, body language, and engagement techniques to connect effectively. Lastly, the visual aids. These are tools like slides, charts, or images that complement your message and help reinforce key points. When you combine these 5 components thoughtfully, you create a compelling and memorable presentation that resonates with your audience and supports your overall message. Let's go over the recommended sizes and insertion distances for endotracheal tubes and laryngoscope blades in pediatric patients. Starting with preterm infants, those under 1250 grams, a 2.5 millimeter uncuffed endotracheal tube is typically used, and a size 0 laryngoscope blade. The insertion distance from the alveolar ridge is about 6 to 7 centimeters. For full-term infants, a 3 millimeter uncuffed tube is suitable, with a blade size ranging from 0 to 1, and an insertion distance of around 8 to 10 centimeters. Moving to children aged 3 months to 1 year, a cuffed tube between 3.5 and 4 millimeters is recommended, with a blade size of 1, and an insertion distance of approximately 11 centimeters. At 2 years old, a cuffed tube of 4.5 to 5 millimeters is appropriate, with a blade size of 1 to 1.5, and an insertion distance of about 12 centimeters. For 6-year-olds, a cuffed tube measuring 5 to 5.5 millimeters is used, along with a blade size of 1.5 to 2, and an insertion distance of roughly 15 centimeters. At 10 years, a cuffed tube around 6 to 6.5 millimeters is typical, with a blade size of 2 to 3, and an insertion distance of about 17 centimeters. Finally, in older adolescents aged 18 years, a cuffed tube between 7 and 8 millimeters is recommended, with a blade size of 3, and an insertion distance of approximately 19 centimeters. Remember, inserting the endotracheal tube, these distances from the alveolar ridge generally places the distal end in the midtrachea, which is ideal for secure and effective airway management. This slide doesn't contain enough information. That's why we're moving to the next slide. This slide doesn't contain enough information. That's why we're moving to the next slide. This slide doesn't contain enough information. That's why we're moving to the next slide. This slide doesn't contain enough information. That's why we're moving to the next slide. This slide doesn't contain enough information. That's why we're moving to the next slide. This slide doesn't contain enough information. That's why we're moving to the next slide. Now, let's take a look at the modified Aldrich scoring system for recovery from anesthesia. This scoring system is a crucial tool we use to assess whether a patient is ready to be safely discharged from the recovery area. It evaluates several key parameters including activity, respiration, circulation, consciousness, and oxygen saturation. Each of these factors is assigned a score, and the total helps us determine if the patient has recovered sufficiently. The modifications to the original Aldrich score aim to improve accuracy and ensure patient safety. Remember, The goal here is to make sure the patient can maintain vital functions independently before they leave the recovery unit. This scoring system ties into the overall theme of patient safety and optimal recovery, emphasizing the importance of standardized assessment tools in anesthesia care. Let's take a closer look at how we calculate maintenance fluid requirements for pediatric patients after surgery. As you can see in the table, the approach varies depending on the child's weight and whether they are able to take oral fluids. For children weighing between 11 and 20 kilograms, the general guideline is to provide less than 1 milliliter per kilogram in the first 12 hours if they are able to take fluids orally. However, if there's no oral intake, the calculation involves starting with 40 milliliters plus 2 milliliters for each kilogram above 10 kilograms. For children over 20 kilograms, the recommended intake drops to about 0.5 milliliters per kilogram if they are able to drink. But if they are not, the formula is 60 milliliters plus 1 milliliter for every kilogram above 20. The key point here is that this method helps us avoid postoperative hypernatremia, which can be a real concern if fluids aren't properly managed. This table gives us a clear way to determine hourly fluid needs during the first 12 hours after surgery, tailored to each child's weight and oral intake status. It's essential to customize our approach to ensure safe and effective hydration during this critical period. This slide doesn't contain enough information. That's why we're moving to the next slide. This slide doesn't contain enough information. That's why we're moving to the next slide. This slide doesn't contain enough information. That's why we're moving to the next slide. This slide doesn't contain enough information. That's why we're moving to the next slide. Let's take a moment to acknowledge the key references that have informed this presentation. First, we have Miller's Anesthesia, which is a comprehensive resource widely regarded as a cornerstone in anesthesia education. It provides in-depth insights into both adult and pediatric anesthesia practices. Next, Rebecca Jacobs' book on pediatric anesthesia offers specialized knowledge tailored specifically to the unique needs of pediatric patients, emphasizing safety and tailored approaches. Morgan's Clinical Anesthesia is another valuable resource, covering a broad spectrum of clinical anesthesia principles and practical applications. Finally, the WFSA tutorial is a fantastic global resource that helps standardize anesthesia education and practices worldwide. These references collectively underscore the importance of evidence-based knowledge and continuous learning in our field, helping us improve patient care and stay updated with best practices. This slide doesn't contain enough information. That's why we're moving to the next slide.